lungs. Upper part C5, lower part thyroid T1. Okay, thyroid gland contains two. Two lobe, left, left lobe, right lobe, and is moves. Okay, thyroid gland contains any lobe, two lobe and is moves. Okay, and contains three surface. Lateral surface, two. Medial surface, three. Posterior surface. Okay. Lateral surface relation by any structures. Lateral surface isthmus. Okay. Lateral surface relation by any structures from sternum. Hyoid muscle. 2. Sternum. Hyoid muscles. 3. Superior. Belly of hyoid muscles. 4. Superior part of the CSM, sternocleidomastoid muscles. Okay, lateral surface, all of structures, relation by all of structures, relation by thyroid gland questions. Excel. Okay, Excel. Sternocleidomastoid. You know how you thyroid, sternohyoid, superior belly of homohyoid, and okay, SCL.
All of them.
Except
All of them.
SCL superior.
Superior
Part of the SCL relation. All of structures relation by lateral surface of the thyroid gland except thyroid. Thyroid not relation by this part. Okay. And another part, the medial surface. Medial surface relation by bond. Larynx, relation by trachea, relation by recurrent laryngeal nerve, relation by esophagus, relation by esophagus, relation by inferior pharyngeal muscle, okay, relation by 5 structures. But posterior surface of the thyroid, just relation by carotid sheath. Relation by which structures? Posterior, just carotid sheath. Question, posterior surface of the thyroid gland, relation by which structures? Carotid sheath. Questions, trachea, esophagus, recurrent laryngeal, carotid sheath. Okay. And secretion by hormone, hypophyseal hormone. Secretion by thyrotropin, okay? Thyrotropin releasing by hypothalamus. And hypo control or impulse hypothalamus, and relation by adenohypophyseal gland, thyrotropin. Okay, secretion by which hormone? Thyrotropin. Thyrotropin releasing by hypophyse. Okay, but vasomotor nerve, superior, branches from superior cervical ganglion. Superior cervical ganglion. Vasomotor. Okay, vasomotor of the thyroid branches from which part?
Superior cervical ganglion.
Secretion,
Thyrotropin.
releasing by hypophyse. Okay, and blood supply by superior thyroid artery and inferior thyroid artery. Superior thyroid artery branches which artery? External carotid artery. Inferior thyroid artery branches which artery? External? No, artery. Inferior thyroid artery branches from which artery? Thyrocervical branch of subclavian. Thyrocervical. Okay. This part finish. Finish. External carotid artery, inferior branch of the subclavian. Thyrocervical of subclavian. Vasomotor. This is superior cervical ganglion, sympathetic ganglion. Sympathetic ganglion branches vasomotor of the thyroid. But secretion not there. Okay, by hormone. Which hormone? Vasomotor. Releasing which structures? Okay. Hypophyse. Relating thyrotropin hormone, releasing of the secretion of okay,
thyroxine.
Hypophyse, thyrotropin, hypophysis. Okay, hypophysis gland secretion, thyrotropin hormone, secretion of the thyroid. The thyroid secretion, thyroxine. Thyroxine, tetraiodothyronine or thyroxine, triiodothyronine, okay, secretion of the thyroid. Location, situated location, okay, and relation. Okay.
Finished.
Prevertebral region contain prevertebral fascia, prevertebral fascia, deep fascia or superficial fascia. Prevertebral.
Deep fascia.
Deep. Okay, deep fascia. And muscles. And two muscles. Muscles of the prevertebral. One muscles longus colli. One. Muscles of the prevertebral region. One. Longus colli. Two. Longus capitis. Longus capitis. Three. Rectus capitis, rectus capitis, lateralis, and four, rectus capitis anterior. Longus lung, okay, colli neck, capitis head, rectus straight, okay. All of muscles of prevertebral region contains two structures. One structure is prevertebral fascia, deep fascia, and another part muscles. Muscles of prevertebral, four muscles: longus colli muscles, longus capitis muscle, rectus capitis lateralis muscles, rectus capitis anterioris muscles, all of muscles prevertebral. Okay, longus capitis, vertebral C1, C2, C3, C4, 5, 6, 7, P1, P2, P3. Transverse process. Cervical vertebra, any number?
Seven.
Cervical spinal nerve.
Eight.
Good. Okay. Transverse. All of cervical vertebra contains transverse process and foramen. Okay, foramen transverse process, foramen transverse. Okay, transverse process contains two two tubercle, anterior tubercle, posterior tubercle, anterior tubercle, posterior tubercle. Okay, transverse process. Transverse process. Okay, transverse process. Langus colli muscles contains three parts: superior, oblique, and two vertical part, and three inferior oblique part. Did you understand? This muscles langus colli contains any part? Three part. Okay. Superior belly, three part. Okay. Superior oblique origin from anterior tubercle of C3, 4, 5, and 6. Okay. Oblique. And insertion origin from 1, 2, 3, 4. Oblique. Insertion transverse process of C1. Origin from C3 and C6. Insertions transverse process C1. Okay. Langus colli muscles. Okay, langus colli is muscles. Superior part is part. Okay, langus colli. Origin contains any part. Anterior tubercle of transverse process of C3 vertebral. C3 langus colli. Langus colli. Okay, oblique. C3, 4, 5, 6. Okay, and origin body of langus colli. Origin from C3, C4, C3, C4, C5, and C6. Okay, and langus colli, langus capitis. From which part? Langus colli, C3 and C6. And insertion body of C1 and transverse of C1. Langus colli. Hola, langus colli. Oblique part. C6, 2, 3, 4, and 3. Okay, langus colli origin from tubercle of C3, tubercle of transverse process C4, C5, and C6, insertion C1. Okay, action, lateral flexion of head. Okay, lateral flexion of head. Okay, and another see langus colli. Okay, langus colli. Okay. Good. Okay, langus. Oblique. Okay, or superior oblique part. And inferior oblique part, langus colli. Langus colli oblique part, origin from body of T1, body of T1, T2, T2, and 3C. T1, T2, T3. Okay? And insertion C5 and C6. Okay? Body of T1, 3, 2, 1. And okay, oblique. And insertion transverse process of C5 and C6. Okay, body T1, T2, T3, origin, oblique, inferior oblique, and insertion transverse process of C5, C5 and C6. Okay, superior oblique, inferior oblique. Okay, did you understand? And another vertebral, vertical origin from body of inferior cervical vertebra and superior vertical origin from body of T1 until T3 and body of C5, 7, 6, 7, 4, 5. Okay, origin from T1, T2, T3, body, and insertion C5, C6, C7. Okay, 4, 5, 7, 4, 5, 6, 7 insertion. Okay, T1, T2, T3, vertical part, and insertion 4, 5, 6, 7. Okay, 4, 5, 7. Nerve supply by C2 and C6. Nerve supply. Again, lumbus colli contains 3 parts: oblique, superior oblique part, inferior oblique part, vertical part. Okay, vertical BT. Okay, vertical branch. Superior origin from C7 and C6, transverse process. Insertion C1. Okay, and inferior oblique origin from body of T1, T2, T3, insertion transverse process of C6 and C5. Okay, finish. But vertical part, okay, anterior part or vertical part. Vertical origin and insertion body. Origin body of thoracic vertebra, insertion body of cervical. Okay, origin from body of T1, T2, T3, insertion T. Okay, C5, C4, C5, C6. Nerve supplies C1 until C6. This part vertical function flexion. Head flexion, okay? And the lateral and the inferior oblique and superior oblique action or function lateral flexion, okay?
Sir, the superior oblique, sir, insertion is C1, the transverse process
Yes.
of C1.
Transverse, the inferior oblique, 1, 2, 3, body, insertion, origin 1, 2, 3, body of thoracic, insertion, C6, the transverse process of C6, C5,
C1, sir.
C1, C1, insertion of the superior oblique.
Yes, transverse process of C1.
No, body and transverse. Body and transverse. Okay, body and transverse. We have supply, okay. And another muscles, rectus, longus capitis muscles. Longus capitis muscles origin from tubercle of C3 is this muscles. This muscles. Longus capitis muscles, origin from 1, C3, C4, C5. Okay? Origin from which part? C. Tubercle transverse tubercle of C3, C4, C5. Insertion inferior surface of basilar part of the occipital. Occipital contains any part, occipital bone, for scallops, basilar, okay, basilar part, and lateral and left, okay, labyrinthine or, okay, labyrinthine. Basilar part contains superior surface and inferior surface. This is muscles. This muscles longus capitis, origin from transverse process C3, C4, C5. Which part is? Tubercle. And insertion inferior surface of basilar part. Flexion, action, lateral flexion. Nerve supply C1, C2, C3. C1 until C3. Okay, again. Longus capitis muscles origin from insertion. Good, very good. Nerve supply. Finish. And another muscles, rectus capitis lateralis muscles. Rectus capitis lateralis muscles. Rectus capitis lateralis muscles. This is muscles. Rectus capitis lateralis muscles. Origin from transverse process of C1 or atlas, okay? Transverse process, rectus, rectus capitis. Transverse process of atlas, insertion inferior surface of jugular process, okay? Inferior surface of jugular process. Okay, origin from transverse process of the and upward and laterally. Okay, upward and laterally, and insertion inferior surface of jugular process. Action lateral flexion. Nerve supply C1 and C2. C1 and C2. And the final muscles of prevertebral rectus capitis anterior muscles. Rectus capitis anterior muscles, this muscles, rectus capitis anterior muscles. Rectus capitis origin from transverse process of atlas or C1 and another origin arc of atlas. What's the meaning arc or arch? Okay, arc of atlas. Two origin, transverse process of atlas and arc of atlas. Okay, arc. Okay, this part, two part, arc. This part, arc. This part, transverse. Okay, insertion inferior surface of basilar part of occipital. Insertion inferior surface basilar part of occipital. Action lateral flexion. Nerve supply C1. Nerve supply C1. Finish. Okay, thank you. Thank you so much. Rectus capitis anterior origin from two parts. Transverse process of C1, arc of C1. Insertion inferior surface of the inferior surface basilar. nerve supply by C1 and C2. Okay, flexion lateral. All are lateral, except longus colli, upper part or superior oblique, lateral flexion, inferior oblique, lateral flexion, vertical flexion of the, okay, right. All are this part, okay, and another are suprahyoid muscles. Okay, rest very well.